Hello, and welcome to the Mental Health Awareness course. By the end of today's session, you will know what mental health is, why people develop mental health conditions, know how to recognize and manage stress, and you will know how to recognize a range of mental health conditions. So let's start off what mental health is. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Everyone has mental health. The term mental health illness covers a very broad range of mental health problems, which can involve changes to our thoughts, emotions, behaviors, and relationships with others. Mental illnesses are associated with distress and problems such as functioning in your day-to-day lives, such as social, work, family, and so on. Mental illness is treatable. The impact of mental health problems can be day-to-day, which is mental ill health can affect many areas of our life and have an impact on your family. Physical health. Mental illness can impair your ability to protect and develop your physical well-being. Work, obtaining or maintaining a job may be more difficult when symptoms of a mental health conditions make it harder for you to function normally. Education, studying may be more difficult when living with a mental health condition, and often students do not reach their true potential. Driving, mental health conditions themselves do not stop people from driving. However, certain medication that the person may be taking will influence the decision. Parenting and children. Mental illness can affect relationships and family life. Certain medication can also have an effect on pregnancy. Stigma. Stigma can create barriers for people to seek help for their mental health condition and can make their situation much worse. So the question is what mental health stigma is. Stigma is a set of prejudicial attitudes and values which may lead to discrimination behaviors. In the context of mental health, there are two main types of stigma. A social stigma includes the negative attitudes and discriminatory behavior that society and or particular individual hold towards those with mental health problems. Self-stigma is where people with mental health problem believe what is being said about their condition and agree with their viewpoints. The effects of stigma can be fear of disclosing to peers that you have a problem. Next one would be reluctance to seek professional support, victimization, harassment, or physical violence, difficulties finding employment and taking part in activities, lack of understanding from family and friends, and develop a practice of self-stigmatization. Coping with stigma. No individual should tolerate others treating them different because of mental health condition. Here are some points to help combat stigma. Seek professional help. Don't let the fear of being labeled with a mental health illness stop you. Show your family and friends reliable information to improve their understanding. Don't equal yourself with your condition. Join a support group to talk about stigma and relate to others. Organize local campaigns and get involved with national organizations. There are a few interesting mental health statistics that I put together for you. 1 in 4 adults experience at least one diagnosable mental health problem in a given year. Half of all mental health problems are established by the age of 14. Poor mental health carries an economical and social cost of 105 billion a year in England and 10.8 billion a year in Scotland. In 2018, in Great Britain, there were 595,000 cases of work-related stress, depression, or anxiety, leading to 15.4 million working days lost. Identifying mental health conditions. So mental health does not simply mean the absence of a mental health illness. It is possible to have a good mental well-being whilst living with a diagnosed mental illness. In contrast, someone who has no diagnosable mental health illness can still have a low level of mental well-being. So for example, I have created a chart for you just to make it a little bit more clearer. So on the top of the arrow, we're starting with excellent level of mental well-being. In opposite, there is a low level of mental well-being. Then on one side, we have a clinical diagnosis, and opposite is no diagnosis. So in between the excellent level of mental health well-being and a clinical diagnosis, we have a person who experiences an excellent level of mental well-being, regardless of being diagnosed with mental health illness. And opposed to that, between clinical diagnosis and low level of mental health well-being, is a person who has been diagnosed with mental health illness and is also experiencing low level of mental well-being. Then, and opposed to excellent level of mental health well-being towards no diagnosis, a person who experiences an excellent level of mental well-being with no mental health illness. And then to just finish the circle off, we have no diagnosis towards low level of mental well-being, and that's a person who has no diagnosable mental health illness and has also low level of mental well-being. Mental health risk factors: discrimination and stigma, social isolation and loneliness, abuse, trauma or neglect, social disadvantage or financial trouble, unemployment or losing your job, having a low-term physical health condition or injury, having a long-term physical health condition or injury, poverty or homelessness, being a long-term carer, drug or alcohol abuse, domestic violence, significant trauma as an adult, such as military combat, and the death of the loved one. Early warning signs of mental health problems may include losing interest in activities that were previously enjoyed, underperforming at work with no apparent explanation, increased anxiety levels, feeling exhausted and restless, isolating yourself and not wanting to socialize, changes in appetite such as skipping meals or overeating, such as binge eating, changes in perception such as hearing or seeing things that others don't, self-harming behavior, signs of cuts or bruising to uncommon areas of your body, reduced or increased sex drive. So what is stress? Stress is the adverse reaction people have to excessive pressure or other types of demand placed on them. What happens to your body when we are stressed? So adrenal gland produces adrenaline. This speeds up the heart and increases blood pressure. The adrenal gland produces cortisol. This increases glucose in the blood and energy production. Over a long period of stress, these reactions can include illness and reduce life expectancy. The pituitary gland reduces oxytocin, and that can reverse the effects of stress. The causes of stress can be work, finances, relationships, personal issues, family and friends, bullying, poor physical health, travel, moving house, poor behavior, or bereavement and divorce. The effects of stress: how you may feel mentally and emotionally. Anxious, low self-esteem, overwhelmed, angry, sad, constant worrying, lack of concentration, difficulty making decisions, racing thoughts, and frustration. There may be some physical effect that you are as well experiencing, such as headaches, tiredness, muscle tension and chest pain, nausea and dizziness, shallow breathing, high blood pressure, and then behavior effects may be outbursts of anger, restlessness and constant worrying, social withdrawal, undereating or overeating, exercising less often than usual, and change in the sex drive. Lots of things can cause you to be stressed, and this isn't something to be concerned about. However, the effect of long-term stress can put your health at risk. The long-term effect of stress can lead to cardiovascular problems, problem with your immune system, digestive problems, behavior change, and mental health conditions. And then there are a few coping strategies that can help, and that is starting with eating a healthy diet and exercise regularly. Look for positive and things for which you are grateful for. Avoid unhealthy habits. Build confidence. Make time to relax and socialize. Ask others to put your own problem into perspective. Mental health conditions. For the purpose of this mental health awareness course, we will focus on the following mental health conditions: depression, eating disorders, anxiety, suicide, psychosis, and self-harm. Mental health condition. This could include a minor episode of depression, thought to a condition that has or may develop into a diagnosable mental health illness or disorder. Mental health illness or disorder equals a mental health condition which has been formally diagnosed by a hair care professional. First off is depression. Depression is a very common mental health illness, and it is when you feel persistently sad and unhappy for a long period of time and affects your everyday life. Signs and symptoms may include feeling irritable and intolerant of other people, thoughts of self-harm or suicide, changes in appetite, weight gain or weight loss, lack of energy, muscle pains and aches, disturbed sleep patterns, and low sex drive. Anxiety, another very common mental health problem. Anxiety is a normal body response which creates feelings of unease, such as worry or fear. Anxiety can be mild or reverse and affect everybody in different ways. Symptoms may include dizziness and tiredness, strong, fast, and irregular heartbeat, trembling and shaking, panic attacks, excessive sweating and shortness of breath, lack of energy, muscles aches and pains, dry mouth, feeling sick and headaches, feeling tense and unable to relax, a sense of dread and constantly feeling on edge, irritability and difficulties concentrating, social withdrawals, seeking lots of reassurance from others. Psychosis. Psychosis is a mental health problem that causes people to perceive or interpret things differently from those around them. This might involve hallucinations or delusions. Psychosis could be a sign of several mental health conditions. Hallucinations is where a person hears, sees, and in some cases feels and smells or tastes things that aren't there. A common hallucination is hearing voices. Delusion is where a person has strong beliefs that aren't shared by others. A common delusion is someone being there is a conspiracy to harm them. Psychosis can be caused by conditions such as bipolar disorder and schizophrenia, but it can also be triggered by other events such as having a traumatic experience. Someone who developed psychosis will have their own unique set of symptoms and experiences according to their particular condition. Signs and symptoms may include hallucinations, delusions, confused or disturbed thoughts, lack of insights and self-awareness, suspiciousness, disturbed sleep patterns, depression and anxiety, and suicidal thoughts or actions. Eating disorders. An eating disorder is when you have an unhealthy attitude toward food, which can take over your everyday life and make you very poorly. Food plays an important part in our lives, and we all spend time thinking about what we have eaten or what we are going to eat. When you have an eating disorder, you will often eat too much or too little and become obsessed with your body weight and appearance. Many people believe if someone has an eating problem, they will noticeably appear under or overweight. This isn't true. Anyone, regardless of their weight, age, or gender, can seriously be affected by eating disorder. Anorexia nervosa is when you try to keep your weight as low as possible by not eating enough food and exercising too much, or both. Bulimia nervosa is when you try to control your body weight by binge eating and then deliberately being sick or using laxative to empty your bowels. Binge eating disorder is when you regularly lose control of your eating, eat large portions of food all at once until you feel uncomfortable full, and are often then upset or guilty. And then we have OSFED, which is other specified feeding or eating disorder. If you are given a diagnosis of OSFED, it means that you have an eating disorder, but you don't meet all criteria for a diagnosis of anorexia, bulimia, or binge eating disorders. It can be very difficult to identify when someone you know has developed an eating disorder. Signs and symptoms might include dramatic weight loss, lying about how much you've been eating a lot of food very fast, going to the bathroom a lot after eating, feeling of anxiety about eating or digesting food, obsessively exercising and sticking to a rigid diet, cutting food into small pieces or eating very slowly, avoiding eating with others or eating in secret, checking body weight and comparing to others, developing physical health problems. Suicide. Suicide is when someone deliberately ends their own life. Risk factor for suicides can include previous suicide attempts, mental health problems, physical, sexual, or emotional abuse, losing a loved one to suicide, drug and alcohol misuse or addiction, imprisonment, bullying and discrimination, and financial problems or homelessness. Potential warning signs that someone is experiencing suicidal thoughts may include threatening to hurt or kill themselves, talking or writing about dying, death, or suicide, making financial preparations such as writing or updating a will, recent trauma or life crisis such as the death of a loved one, talking about feeling hopeless or having no purpose, talking about being a burden or nuisance to others, anxious, agitated, or acting reckless, increasing the use of alcohol and drugs, and withdrawing from activities and feeling isolated. Self-harm. Self-harm is when somebody intentionally damages or injures their body. It's usually a way of coping with or experiencing overwhelming emotional distress. Self-harm is more common than many people realize, especially among younger people. Reason for the self-harm may include relieving distressful emotions, a way of communicating their distress, bereavement, or the end of a relationship, physical or sexual abuse, a way of punishing themselves, confusion about sexuality, being bullied or having difficult relationships, alcohol and drug misuse. Potential signs and symptoms of self-harm may include unexplained cuts, bruises, or cigarette burns, usually on their wrists, arms, thighs, and chest. Signs of a low self-esteem, such as blaming themselves for any problems or thinking they are not good enough. Keeping themselves fully covered at all times, even in a hot weather. Signs of depression, such as low mood, tearfulness, or a lack of motivation or interest in anything, and claiming to have a frequent accidents or mishaps. I hope you have enjoyed today's mental health awareness course and you found it very useful. Thank you for your time.